I'm Steve White. We're going to start talking about some of the side effects that can happen from chemotherapy. Now, I want you to understand again, we're not experts. And I say that we're very experienced. We spend a lot of time. I can't get enough of research, so I love to research, love to read. But I'm always going to tell you, your doctor's the expert. So when we talk about side effects, first one we're going to talk about is anemia. When we talk about anemia, who's the person you're going to go to find out the expert information? Your doctor, okay? He is an expert. He's going to give you basic information. Sometimes they don't expand very much on what they're saying though, and they don't give you a lot of detail. So I'm gonna say things more in layman's terms and give you maybe a better chance to understand what we're talking about, because it's actually pretty simple. Anemia happens because chemotherapy can affect, remember, it affects the fast-growing cells in your body. One of the places that you have fast-growing cells is in your bone marrow. That's what creates your blood, okay, the red blood cells. And red blood cells carries oxygen throughout your system. So if you have a shortage of red blood cells, you have side effects, okay? What are the side effects? Well, you might feel like you have a pounding in the heart, and it's because your heart's struggling. It's not getting the oxygen it normally gets because there's not as many red blood cells. You might find yourself feeling dizzy, tired. Anemic people usually feel tired. You feel kind of a different kind of tired. You'll get to know what that feels like. Well, I hope you don't, but if you do, you'll understand that it's a little bit different. So you can feel tired. The other thing is you can feel kind of dizzy. Sometimes people get kind of confused feeling. They don't feel like they're thinking clear. It's all because there's not oxygen going through their system. Okay, so that's one of the reasons why when you listen to your coach advocate and you look at our program, we're trying to get you to circulate oxygen, circulate blood, move, okay? Just move, breathe. Why? Getting oxygen. You know, it's really funny. Working out and all the benefits of working out, all those kind of things, it's really very simple. You want to get your body oxygenated, okay? So you want to get things moving. So we're going to deal with anemia, we're going to deal with some of the side effects, and maybe some things that you can do to minimize. Now, something I'm going to always keep telling you, preparation. I always tell people, you don't wait till you're anemic to prepare for anemia. When you start chemotherapy, if you're on our program properly, you're looking at all the things that you can do and you're doing them all, sometimes they won't happen. I've even had patients come back and say, well, I don't know why I'm doing all these things, nothing's happened. Exactly, good. Because they prepared. So there's things that you can do to be ready. For instance, being anemic, sometimes when you stand up, you get that lightheaded feeling. Okay, so I'm gonna wait till that happens and I fall one time? No, just prepare. It's like being in a game, again, prepare for everything that might happen. So when you're on chemotherapy, get yourself used to the fact that when you stand up, you should kind of be checking things. You should be pushing off something, making sure something's there to stabilize. Teammates, this is the time we get to love our teammate, the person, the patient, okay? So hold their arm when they stand up. Walk near them. Don't walk ahead of them like I always do. I always take off and I'm walking real fast somewhere. Slow down. Wait for them. They're not going to walk maybe as fast as they normally walk. Be next to them. Be around them in case they're anemic, in case they get lightheaded for other reasons, in case they feel sick for other reasons. So it's anticipating these problems so they don't happen. I have patients that'll say, boy, I stood up, I got dizzy, I fell, and I broke my hand. Well, we should have prevented that, okay? Yeah, we're gonna deal with it and we'll do the best we can, and things do catch you off guard, but prepare, think about it. When you go upstairs, when you're going places, when you're driving, do you feel up to it? Has the doctor said that your red blood count is low? Okay, remember, he's testing you all the time on these things. Are there other signs that could be happening that would let you know that maybe you're getting anemic? And then what do? The key, it's the key to every sport, it's the key to every relationship, it's the key to everything really, communication. Communicate how you're feeling. The nurse and the doctor can't anticipate you're getting anemic if you're not communicating. So when you get the first signs of anemia, you want to communicate. You want to continue to communicate with your teammate. Teammate can place that call. Teammate can talk to your coach advocate. Coach advocate can say, hey, you might want to be a little bit cautious here because maybe they're getting anemic. So it's preparation. Don't wait till it's just happening. Let's talk about some of the things that happens when you get anemic. Okay, so when we're talking about the side effects of anemia, like I said, it can be dizzy. The number one side effect that I see is you feel tired. You feel droggy, okay? You just don't feel like moving, okay? It's okay. Relax about it. Let's just try to combat it. What's the best way to combat feeling tired? Sleep. Sleep is good, okay? And again, don't wait till you're anemic. Right from the beginning, we're going to be really focused on getting good sleep. I always talk about it being 8 hours in a spa. See, in my life, many times sleep has been something I have to do. Oh, I guess it's time I got to go to sleep so I can have a day tomorrow. Don't do that anymore. Stop, slow down, make it a ritual. What do I mean by that? I don't know. Is it good music that calms you down? You take a shower. When you go to the spa, you know, they put really snuggly things on and your bed is really comfortable. Take a little more time, and teammates help them take a little more time to think out what would make them ultimately comfortable in bed. And also something that's just personal preference for me is watch what you watch on TV. You don't want to watch disturbing movies. It's a real pet peeve of mine. Try to find the things that are relaxing, the things that are encouraging. You know, you've probably heard of the book, and there's a lot of research that laughter is a major cure and really helps your body. When you laugh, you relax, and there's even shows that there's side effects and after effects, that your body becomes relaxed for long periods of time after a really great belly laugh, okay? So maybe before you go to bed, an hour before, you watch a funny movie, then you go to more of a relaxing movie, whatever it is that works for you. Music, reading, the shower. I like showers because, remember, you got toxins going in your body. We want to get the toxins out. I've said before, there's different ways to get toxins out. One is breathing, deep breathing. You know, I've heard people say as much as 80% of toxins come out of your breath. I don't know, don't care. I know it's a major amount. Maybe it's 50%, maybe it's 30%. All those are significant amounts. Okay, so deep breathing. Before you go to bed, nice deep breaths. And it doesn't just mean in, it means out. Okay, the other one is showers, like I said. The biggest way to get stuff out of your system, in my opinion, is your skin. I don't know if you know this, but whatever you put on your skin goes into your body. You know, there's a lot of proof of that. But also things come out through your skin. So when you're in chemotherapy, you might want to take a lot of showers, a lot of baths, and scrub down a little bit. Be careful, your skin can be very, very sensitive. So watch what you put on your skin. You don't want anything that's alcohol-based, you don't want anything that's abrasive, but it's okay to take a shower and dry off really well. And a lot of people don't know this, but it's the drying off part sometimes that really helps the dry skin go away. So those are some things that are getting the toxins out of your body, but when you're anemic, it can also be things that help you relax so you get great sleep. How much sleep? Well, you know, the norm is to say you should be at least 8 hours of sleep. But if you need 10, take 10. Sleep, it's okay to take naps, we'll talk about that in a minute, but sleep in a long period of time is phenomenal. And again, we don't need to go into all the reasons why. It's too obvious. It's true. Okay, it's just true. Nobody's gonna argue with that. You need sleep. So, get at least 8 hours, but if you get 9, you get 10, then everybody should be high-fiving in the morning saying, great job last night, Mom. You got a great night's sleep. Okay, this is an important part of your program, of your training program, of your 23 hours that you're not at the doctor. And it's going to affect what happens even at the doctor. Sleep is huge, and especially with anemia, you want to get rest. That way your body can get energized, and guess what? Your body can rebuild itself.